Hi everyone. A research review on a clinical condition gave us more things to learn. Here is a presentation by myself Dheeraja Devi Veliyanur and my partner Aishwarya Prasad on the topic Tourette syndrome and its nutritional intervention.
Our second peer-reviewed article is a case report and a brief evaluation of a successful nutrition-based treatment for Tourette syndrome that signals pharmacological side effects. The main aim of this case study is nutritional assessment and dietetic support. Usually the patients with Tourette syndrome may engage in impulsive eating, and due to the side effects of frequently given drugs they may have overweight and insecurities. So by this case study we are looking forward how to improve the patient's quality of life with proper diet. Here, the participant for the case study is a 9-year-old male child named Matthew. He was being treated with a combination of many drugs including antidepressants in 2014. As per the usage of drugs, he started to exhibit side effects like nutritional emotions, gastrointestinal problems, hyperphagia and weight gain. It was noted that he had weight gained of about 20 kg following this diagnosis of Tourette syndrome. For a second opinion, Matthew was taken to hospital in November 2017 and excessive sweet tooth, skipping breakfast regularly, eating unhealthy snacks in between meals and low fluid intake were all revealed by the dietary history. A cognitive behavioral treatment program started. His medication is changed, low dose of risperidone and haloperidol was provided daily. A 5-month plus individualized dietary plan was developed. Appointments for routine nutritional follow-up visits to track the development of food habits. The 5-month strategy was split into 3 stages. The first 2 months plan attempted to stay as close to Matthew's typical diet and introduced all forms of protein like fish, meat, cheese, legumes, eggs and cold cuts. Secondly, introduction of vegetables and entire foods that were previously prohibited because of the digestion issues. The final plan completely supported the Mediterranean diet. So from the result, it was seen that after 2 years, at the age of 15, Matthew with a body weight of 81 kg, BMI was of 24.7, which was before 26.8 kg. Matthew's BMI reverted to normal ranges. Even if the weight is increased, it should be recalled that children continue to grow linearly. Slower rate of weight gain or weight stabilization eventually resulted in a decrease in the absolute BMI. The significance was not only having a nutritionist on the care team for TS patients, but also of making sure that the dietary program perfectly combines a comprehensive approach in order to achieve a long-term success. Article 3. Determinants of nutritional supplemental use in Tourette syndrome children. The main objective of the current study was to examine the intensity of nutritional supplements and special diets for children with Tourette syndrome and generally developing kids. In this article, the lead researcher and the management team designed a survey on social media based on the comparative study of evaluating the pattern of nutrition supplements given to kids with Tourette syndrome and normal kids. The survey was being done with parents, healthcare providers of the children. They got 76 responses in total, and of which 42 were having Tourette syndrome and 30 were normal kids. On the survey, the questions asked were like inquiring about the child's need for nutrition supplements and or special diets. There are a mix of closed and open-ended inquiries, details on caregivers regarding supplements and special meals. The study covered supplements in their various forms such as capsules, powders, and gels. So the data collected were children's BMI scores, counted how often kids with Tourette syndrome and TD use special restricted diets and nutrition supplements, variation in sex, age, and medication use, the use of nutrition supplements, special diets, and medications in children with Tourette syndrome and normal was compared. So the results showed that mostly preferred supplements for kids with Tourette syndrome was probiotics, omega-3 fatty acids, multivitamins, and magnesium. For normal kids, their malnutrition was rectified. In the Tourette syndrome group, 75% of the supplement users have reported improvement, mostly in motor and vocal tics, sleeping quality, and anxiety reduction with minimal side effects. Thank you.